Hello, my sloffies. Today, what you're hearing right now is this ducklings in the background. But yeah, I'm back. So, welcome to another episode talking about more on the depth of the current research that UK so far is working towards with infantile pompe disease. I'm really happy that the 25 new subscriptions, honestly, it means a lot. I really hope this channel actually can help someone out there with the information or shared experiences with the families like us. And it doesn't have to be about, families living with infantile Pompe disease. It can be families that are with children with a muscular weakness, like muscular dysgraphy. I can't say the word. That's my dyslexia kicking in there. Sorry. Who has any muscle weakness, basically. And some in need of very intensive medical equipment. It doesn't infantile Pompe. There are families out here who struggle with children with the ventilator, has an NG tube and wants to be normalized. And, this is what this channel is for. I'm working towards it. It's those conversations. It's like a podcast for that reason. And having these discussions. So I've been reading into the NHS UK, the 2021 study on infantile Pompe disease. And it seems from most previous studies that I have read from around 2015 to 2016. It explains uncertainty on the effectiveness of the drug. I mean, I say I've read it, I've kind of read fragments of it. I was trying to get a data table to compare the survival rates between the ages of the children because obviously I'm quite scared. I don't know how long my son has. Obviously, I should be just making the memories and enjoying what I've got. Scary. So I was just looking at the tables on that and seeing the statistics on the survival rate because I know there's no actual real statistic, but reading on the 2015 and the 2014, the ages that I did see was 12 to 14. So yeah. So in the 2021 studies, it expands more on the results, where are the previous ones was more like a graph, like what I've said. It's more like a graph, like a diagram. I'll find the link so you can see it during the reading of the studies. I did notice that the statement that had the result of the ERT treatment with a certain age range, this would be enduring with it still in a bare evidence, very low. So basically, the evidence that was showing in the studies is quite low anyway, which itself seems uncertain whether the effectiveness of the drug. Before and after study 2020 provided evidence relating to the survival and the end of at the end of the study. It compares the outcomes in the infants newly diagnosed with infantile Pompe disease who were treated with the this is where I struggle with the one word alloglucoside alpha 40 milligrams slash kilograms once weekly, with the outcomes in these treated with the 20 milligrams to the kilograms once every 2 weekly. In the licensed dosage, maximum follow up was 8. Sorry, maximum follow up was 8.3 years in the 40 milligrams slash kilogram group and 12.6 years in the 20 milligrams kg group. So the more they gave, they lasted less in the studies of 2020, which is a bit wow. Okay, I found that quite interesting because we fought for the weekly for Leo, and that's why I'm saying this. So when it's saying this, it's quite, I don't know. Does it give the risk of more antibodies willing to fight this condition? So the more that you put in the body, is it more likely to fight a resistance to it with the antibodies, which is a concern, and it does happen with children who are Crim negative are more likely to reject the drug. The children with Crim positive provide some sort of enzyme that it, there is a risk still, but just less of a risk. Um, Again, this is all unknown, and I'm just trying to throw these information out there. Correct me if I'm wrong. Say in the comments if I've got any wrong. correct me. I'm an open book to learn, and I want to share what I find and help me understand and help everyone understand, so we can, us parents, have this communication for children with infantile pompe, because it's scary and it's just unknown. Um, at the end of the study, the difference between the groups was not statistically sufficient for the outcomes. 11 to 12-year-olds, 92% of them survived in this study. Survived in on the 40 grams to kilograms group, compared to the 4 to 6 year olds, 67% of patients in the 27 group. Very low. Dosages were increased 40 milligrams kilograms once weekly in a 4 surviving patients, medium ages 4.1 years, receiving 20 milligrams to kilograms once every 2 weeks because of the clinical deterioration. It's possible that this dosage increase caused the difference between the groups to be less than it would have been if they had been remained on the 20 milligrams to kilograms once every 2 weeks. I mean, I hope my son wasn't in that statistic. It probably was. It doesn't have the patient's names on this, by the way. They'll just be like patient numbers. So I do know what my son's number is. I just so reading it, I noticed a difference with Leo when he did do this weekly treatments on the Myozyme weekly. He responded well for 6 months. His health improved, but when Leo was moved to it 2 weekly, the Myozyme, his health and immune system seemed to have struggled with chest infections. Sorry. During this time, Leo wasn't ventilated, but he did have an NG. It was only 6 months later he ended up on the ventilator. He was still on 2 weekly, but Leo kept on having these chest infections. The NG and using an NG went on from 2015 to 2018. Leo finally got his gastro surgery, an NG from 2015 to 2018. 2018 is when Alder Hay intervened and actually gave him his gastro, because his weight was fluctuated whilst we were living in the hospital for 2 years in Manchester's hospital. The surgeons kept on cancelling his operation and to move the NG to a gastro. They kept on delaying it. It goes to the point that I got fed up and waiting for a date. Struggled with eating, and every small cough would cause the NG to move up and down and would make him gag, and he would vomit, which then led to silent aspiration or aspirating, which is causing to a chest infection. So it was all these little small bits that added up into a big thing, which made him even worse with the NG. You're only meant to be on the NG for 6 weeks. He was on it. He was using the NG from 2015 to 2018. That's about 3.5 years to be on an NG. That's like ridiculous. And they all knew he would. They knew he's never going to eat. They knew. They kept on telling me, stop feeding him. He's never going to eat. He's weak. He's got a weak muscle. Don't feed him. He needs to be on the NG. Yet they dragged the feet to give the gastro. One sec. So I got involved, and I got a date within 3 days. For like 3 days, I didn't complain. So I couldn't wait anymore because he needed this done, and it enraged me the fact that I waited so many years just for a gastro procedure when you have an NG. It was just ridiculous. Why did it take so many years, and why did it take me to go to pals for them to finally find a date? And these surgeons just keep on coming and going. They they knew. I just can't get why they dragged their feet. But when I got to this date, 2016, a doctor pulled me into the room and explained that there was no point because Leo is not going to make it soon. He was going to die, is what they told me. Putting him through this procedure would be unfair. So me being young and naive, trusting the medical professionals, I agreed. Even though at that point Leo was stable and was in good. He was in good health. There was nothing wrong with him specifically at that point. I will even show you the pictures of Leo at this time of his health while we were discussing having meetings about this. There was a lot going on between 2015 and 2016. Life got harder at this point and even worse to some extent. Like, I think 2015 and 2016 was my rock bottom. And this isn't just Leo. I'm not talking about Leo. I'm not talking about the pregnancy with my daughter. It was the ex, basically. It got worse. Um it's quite traumatic. In 2018, he got the surgery in a different hospital in October, and it was finally done. And since Leo had this gastro, he put on loads of weight, wasn't vomiting all the time at all, and was not having constant infections due to the aspirating into his chest. And that's where I get my assumption of all this is, you know, as soon as he had that gastro, Leo bounced. He was amazing. He wasn't skinny. He wasn't aspirating. He wasn't struggling. He wasn't. This is what makes me go, well, why didn't they do this? Why wasn't this done? Maybe the Myozyme didn't make much of a difference. That's what I'm thinking. Like, maybe if he was on 2 weekly, he would have been fine if the gastro was just on top of, and that is a very simple, quick procedure to do. So that's why I'm a little bit like assessing everything. Sorry, I've gone on a tangent here. I can't remember why I started this part in the script. As you can tell, I'm reading from a script, trying to be organised more, and as you can tell, I've got a microphone to sound better because my husband is very quiet talking. So you'll actually be able to hear him because I've got another little microphone for him, so we can actually improve on my videos. I'm gonna edit this one as well, so don't worry. Once things settled down, then I thought Leo's enzyme treatment to be moved from weekly to weekly again. When things settled down, I fought for him again to have weekly treatments. We won the case and finally got him to on the Myozyme to back to weekly treatments. It went well for 2 years. His movement was his breathing and him handling chest infections was good. His heart echo was all in the good and clear until 2022. Leo had his first SVT. SVT, his teeth in his lungs, twice in 1 year, and then Leo starts to have minor reactions to the treatment. So that's when, with the signs of redness marking, spiking temps, high heart rate, the higher dose seems to not work as effective long term. That's what I think. I think he slowly started to build a resilience to the Myozyme. Or was it smaller factors at play? Again, the NG that did also cause long, a long permanent damage. Or that year of the stress of the SVT and the tooth and the lungs led to the infections. I'm not sure. All of it is circumstantial, like this research. All of it. Again, it's so unknown, but from my experience and children with pompe, my God, you push as a parent to get that gastro because I regret not just sticking to my guns and just trusted the professionals. I mean, trust the professionals. It's getting that hard balance of listening to your doctor and then going, no, we need to push for this. It's getting that balance. Trust doctors. Doctors are important. I need to stress that because there are good doctors out there. But from my personal opinion, and I really stress it not, unless your children's not showing any other symptoms, go for the NG. Like gastro, don't let them sit on that gastro any longer than 6 weeks because he was stable. We were in the hospital for 2 years. There were stable months where he could have had the surgery and they didn't. They didn't push for it. They didn't go take this opportunity to just do the surgery. They didn't. And that's what annoys me. There were opportunities. There were moments where he was quite unstable for a few months, but then he'd recover. And then why don't we get back to that? And it wasn't. It was very stressful. Back on the tangent again. Like when it comes down to it, Leo was on the weekly. We have coped better with all these issues. One thing I don't agree is fair is when the hospitals in the UK have to all agree to change the ERT to weekly to 2 weekly or 2 weeklies to weekly. I find it a bit difficult that other hospitals can really get the idea on whether the child will benefit from the dosage when they haven't even seen them. Or statistics class Leo as a failure. Was he treated like that? I don't know. Well, it was wrong. He is still here to this day. He did suffer a lot before we got to all this in place. So it got so bad that it shouldn't have got to this point, is what I'm trying to explain. Is like they did kept on telling me he's gonna die, he's gonna lose. No, he's bad. It's not good. Don't do it. I wouldn't push for it, and he kept on proving them wrong. And I'm like, well, he's proven you this wrong so far. Why won't we just give this child a chance? And he's still to this day proving everyone wrong. So I'm just very baffled as to why no one is, willing to give him a chance. He's crim positive. He's not crim negative. He did get diagnosed late, but every child's different. Got diagnosed very late. But the three hospitals is what concerns me. The three hospitals. I know it's good to not be emotional when you're making these decisions for the drug because it's a lot of money. I understand that. But at the same time, they haven't seen the child. It's like a doctor coming in for 5 minutes, which I've seen a few times in my experience. Oh, that mental child, he's fine. You've just been here for 5 minutes. You haven't dealt with him for like 6 hours. I've just been doing physio, cough assist, suction. The carers have been running around trying to help me assist get him stable. You've now just seen him in a stable state because you've just walked in for 5 minutes and gone, oh, he's fine. He can go home. We go home, come back in an ambulance. Yeah, he nearly died again. Why? Because you literally for 5 minutes walked in and went, fine, go home. It's communication and some doctors, some doctors, and some hospitals. One hospital doesn't even know how to deal with a vended person, so it's just very nerve wracking. Even though they do have a ICU in the hospital, but still can't deal with a ICU like patient like my son. It's That's another door to go and talk through. It's insane, and I feel like much more support and I feel funding and training should be put in hospitals. That's what should be done. We are currently on the Ava drug 2 weekly, and it's a high dose, but 2 weekly, and we don't have any of those reactions anymore. He's responded really well. So Leo's old dose on the drug on the myozyme was 20 milligrams slash kg compared to the new Ava drug 40 milligrams kg. Now, is it the amount or that's the issue, or is it the weekly compared to 2 weekly? Is that the problem? Is it too much and it's not letting the body naturally absorb it? I mean, it's like it's a theory. The research and the result of this research, UK NHS explains this study provides very low certainty and evidence of no difference in the proportions of people surviving with the alcohol I can't say the word. Allocucliside alpha, the alpha drug. I'm sorry, 40 milligrams once weekly is compared with the licensed drug. However, this result might underestimate the survival benefit of the 40 milligram slash kg once weekly group. There is no evidence identified for the outcome. This is how scary this all sounds. There is no evidence identified for the outcome of the alpha than the myozyme. As far as to new on this paper, as it was wrote in 2020 to 2021. This paper was written, this study that I'm reading now to you guys, and I will link to this as well. It says the patients survived ventilation free in the very low dosages increased on the 40 milligrams to the kg once weekly in this for surviving patients, medium age 4.1 years, receiving 20 milligrams once every 2 weeks because the clinical deterioration. Uh, how old was Leo? How old was Leo in 2020? So let me go back. Leo. That's not Leo. But, when it says 4.1, it means 4 years, 1 month, I think. I think that's what it means. It is possible that the dosage increase can cause the difference between the groups to be less than it would have been if they had remained on the 20 milligram slash kg once every 2 weeks. Dose ventilated free babies benefited. Dose ventilated free babies benefited more on the increase of the treatment from 20 milligrams to kilograms to 40 milligrams to 40 milligrams slash kg every 2 weeks. They don't confirm this as it is because of a low of how new the drug is. And there are not a lot of children in the research. What is insane but harsh really of all this is those templates label the certainty of evidence very low, low. It's just crazy, isn't it? With the lack of evidence, it could just be more freaking out, such a scary unknown. Because again, the evidence is low because you can't really 100% confirm it or not because they don't want to get information wrong and confuse it. So at least there is some research in this now, but so far reading this is scary. It's just a bit unknown, and I think it's still quite scary for me right now. It takes it talks about motor function of these children. That is about the motor function of these children. And it stresses the importance of the parent and the carer to keep on top of this with the motor skills. As the normal standard, it should be more focused and encouraged on the motor skills to keep on top of because they are much more vulnerable with this. The study assesses the ability to the walk and the AMS and the BSID/11 scores in infants newly diagnosed with infantile pompe disease who were treated with alaclucazide alpha, the alpha, sorry, Alec does that whatever it is. It's just the nickname shorter for it is Alpha, which is what my son's on Ava or Alpha milligrams, kilograms once weekly, and off the label dosage, and equals 12. I don't know what that is. I don't know what that means. I'm not a scientist. I'm reading some of the quotes in the statement in the research. This is a quote. Um, with the outcomes in these treats in those treated with the 20 milligrams once weekly 2 weeks, the licensed dosage n/6. I'm not sure the terminology. Again, just anyone can clarify what that means. Yeah. A large proportion of the patients using the drug alpha 40 milligrams once weekly achieved walking outcomes compared to the patients using the licensed dosage. However, the difference was only reported to the statistically significant for the ability to walk at 3 years, and the results of the other outcomes are still unclear. This is so unknown. Ventilation for use infantile pompe disease long term with a scale used to the BSID 11 scores is not known. Standard minimal clinically important differences. Wow. Which would make sense for the motor skills and the walking skills vary so much in these children. Leo started his deterioration was an ability to eat and breathing at 3 weeks. So his sign of his deterioration with his health and the disease was the eating, the mouth, the muscles. The mouth muscles is the first thing to go, and then his motor skills and his head strength was really weak. So we know for children who are has classic infantile. I like to do it as classic infantile, and then there's the answer for the adults. Now, classic infantile, as I'll always stress with everyone else, I feel we make it past one, and it's still infantile Pompe disease. It's just an extreme strain, and I'm not saying mine's worse than yours. We're not playing that game. That's not what's happening. From what I've witnessed, my son wouldn't have survived, and he deteriorated physically with his eating, breathing, talking, everything was just floppy and gone, and not at like a few months old, where I've seen other children who are infantile pompe but could still, at the age of 1 or 2, eat, talk, and drink and do walking, but they are still infantile, but they were just and still had that floppy um the head, and it did take a lot on them. I'm not belittling them, but you can see a bit of a comparison of the strains. I'm not strain of the disease. I'm not saying, and I can't stress this enough, that they're worse than them. It is just the same. They are all struggling, and it is horrible. And I feel sorry for both sides of the parents. But understanding is what I'm trying to work on towards this. Again, it's not a point score. Mine's worse than yours. I can't stress that because I don't want that. That's not what I'm aiming for. Trying to understand the disease, trying to know the difference of the disease, because I was a little bit confused as a parent when I would turn up and go, "You've got infantile pompe." Well, when was he diagnosed too? And then I'm like, mine was like, what? What did we do? Why was he so bad? So it was these questions, and that's why I'm starting this conversation, because it is scary, and the more we don't understand, the more we don't know, the more scary it is, and the fear we have. And that was the fear I had. Like, is my child gonna die now? Because okay, I don't know, but this is the conversation I'm trying to put towards. The certainty of evidence is very low on the alpha 40 milligrams that's kilograms once weekly infusion associated with reactions are important to the children with the disease, because they can be very unpleasant and sometimes severe, or even if life threatening. Also, they can occur repeatedly with the subsequent infusions once before and after a study. At 2020 provided evidence relating to the infusion associated. So that's what I've read so far. This video is more on the study on the effectiveness of weekly to 2 weekly to 40 milligrams to 20 milligrams, and I got some of the statements from that. It's just fascinating. May not be good. Maybe with the myozyme, it seems to be people are reacting now to the myozyme long term on weekly. I have no clue. So I hope this video helps. And as you can hear the bird. I'm going to just show you the duckling because he's just pretty much here. He's just been born today. So this is where I burn myself. Oh, I've got a heat lamp. That's what you can. Woohoo! Hi. Anything to say, Ducky? He's just been born today. Yeah. So that's what you're hearing in the video. So I do apologise. But yeah, this is part of the study. I'll expand more on, but life's been busy. So thank you for watching the video. I hope it was interesting enough that it wasn't so um informative, and that I'm sharing the information. Anything I've done wrong anything I've done wrong, anything I've said wrong, please leave in the comments and I will correct it and stuff. But yeah, that's the video for today, and thank you. Bye.